Okay, so it's again my pleasure to introduce our next speaker, Andrea Burrows. Andrea is a PhD student in nursing at UBC, a member of our first cohort of Health Equity Stream, and also a nurse herself. Andrea's work is on how nurses and families use technology to build relationships and use tailored technology to increase access and better care, access to care and better care. Her work focuses on pregnant people and families with young children living in rural areas of British Columbia. Andrea. It is bright.
Okay. I just need to shake out a little bit. So let's get everybody up, just shake it out a little bit. Everybody stand up for a second. Yeah. Ooh. All right. Maybe reach it. Oh, I see some people doing this. Over to the side. I know, little different, but oh, good. Nice. Okay. Been told to breathe out of my nose, so that's what I'm trying to do. All right. There's been a steady uptick of using digital technologies in health and social care for over 20 years. You might conjure up this idea of medical house calls or using the telephone as archaic practices. But in 2020, everything changed. The COVID-19 pandemic and with public health measures, we transitioned from in-person to using digital technologies. Now, many of you might be familiar with receiving a video Zoom with your healthcare provider, a meeting with them. You might be getting text messages or sending photos to your healthcare provider, or even you're receiving information and filling out forms online. If you were pregnant or giving birth during this time like I had, the meetings with the public health nurse, shifting them from in-person to using technologies was a big deal. Now, transitioning to parenthood is one of the largest experiences of one's life. It is filled with uncertainty and stress. Are you doing the right thing? Have I got my schedules down? Information over here, and it's conflicting. What do I do? But at the same time, filled with absolute joy and happiness. So it's no wonder that connection with the public health nurse is so valuable. For some, it's a lifeline, and others, the nurse becomes like a family member. It's not surprising at that time that technology was a promise to access. It was connecting, extending services to smaller communities, and it was capitalizing on availability of subject experts. For many, it was convenient. But for families who were experiencing multiple responsibilities, social and economic challenges, they were talking about something different than access, or in conjunction with access. They were talking about the need for more contact, more forms of contact during this during this time. They were also saying for those that were receiving more intensive services that loss of connection and relationship with their healthcare providers was really important, or was challenging. And nurses were talking about the loss of access to the home and to the community. So where in relation to the community was this individual situated? Were there transportation challenges? What were the health services available in that community? And going into the home and doing an assessment of what was in the cupboards or what was in the fridge. Those key pieces, along with the ability to pivot and do the much needed physical assessments, those key sources of information were contributing to hesitation and concerns around delays in care. Now, I got involved in this project before COVID in 2020. I teamed up with while I was working for Interior Health as a knowledge mobilization expert with the research department, I teamed up with 2 public health nurses providing intensive services with families and 2 mothers. And what they wanted to know was, how do you develop and maintain a therapeutic relationship using technologies? So they were already using technologies. Yes. So here we are, widespread implementation of digital technologies to deliver health and social care. And the big question in everybody's mind is, does it contribute to health inequities? So taking that big question and the question that the nurses and the families want to know about, developing therapeutic relationships, this work centers around, well, how do nurses make decisions? What are the factors are they making their decisions on? What weight do those factors have in their decisions around which technologies to use? For whom? What sort of resources and capacities do the families have? In addition to what purposes? What sort of information is it? A knowledge sharing? Is it knowledge collection, negotiation, and care? And then within this wider health system, so what are the mandates of our health system, our organization? What is the training? What is the support for nurses? How is the integration? And all of this towards a better understanding of how nurses tailor technology to meet the needs of our families. Because when it all boils down to it, this is who it's for. Access and volume may be what you hear the loudest, but technology is not a solution to our social problem of access. It is a tool, a disruption to the system, an opportunity for us to imagine how we provide better care, more points of contact, better support, because advancing health equity is what needs to be about what makes sense for families and nurses. And our public health system needs to do more to support our families. Thank you.